Everybody, welcome to the Healthcare Uncovered Show. I'm Joe Rotino.
And I'm Wendell Potter.
Wendell and I have worked together for 10 years. We crisscrossed the country from New Mexico to Alaska, Missouri to Puerto Rico, telling people stories, documenting the fine print, and yes, uncovering what's really wrong with America's healthcare system. In 2025, 7 big for-profit health insurers raked in $1.7 trillion in revenue. They made $54 billion in profits. All the while, they insured 10 million fewer people than they did in 2024. Revenues are up. So they did that by raising prices, having harder barriers to care, and funneling people to the taxpayer-funded programs that they run and the subsidiaries that they own. As we said in our last episode, not everything's hunky-dory for these companies right now, but they are still printing money. And as far as corporations go in this country, they're at the top of the food chain. UnitedHealth Group is bigger in terms of revenue than Apple. Right. CVS takes in more revenue than ExxonMobil, for instance. Cigna and Elevance, which I don't think is a household name, they're bigger than Chevron. Mm-hmm. Centene, that company's bigger than JP Morgan Chase. Humana takes in more revenue than Bank of America. Molina takes in more money than Visa and Salesforce. And I think they're able to get away with a lot of the shenanigans that they do because people don't know how big these companies really are. And that's why on this episode today, we're going to talk about the earnings reports. Right. And we're going to dive in and we're going to show just exactly how big these companies are and where they stand in comparison to the rest of the companies in this country.
And we started calling this part of the industry big insurance because it really is. It's enormous. That's not a term that anybody used when I was in the industry, but it's very applicable right now. Mm-hmm. Even the president has called these companies big, bad, money-sucking companies. And he's right. These companies are making more money than any company in this country that actually makes anything.
True. And Wendell, why are you the guy to talk about earnings reports?
Well, my name was on Cigna's earnings reports for 10 years. I was the guy who was on the phone with reporters from the Wall Street Journal and the New York Times and wherever, whenever the company announced earnings. I helped put together the press releases. So I had to know where the company's money came from, what they did with it. And what I learned during that time was who they really care about, and it is the shareholder that they care most about.
So your name was on all of the earnings reports.
Mm-hmm.
Up until what year?
2008. That was my last year.
So how have these earnings reports changed? You can speak personally for Cigna, but I think we can look at all the companies.
Yeah.
But how have these earnings reports changed from 2008 to 2025?
Well, for one thing, they're much longer, much more complex, but at the same time, more obscure because it's really hard unless you know how to read these and do some math to figure out just how these companies are making as much money as they are and how they're doing it. But they're bigger. These companies are vastly bigger. In fact, I think the whole industry is about at least six times bigger in terms of revenue than it was when I was there. And they've gotten this big through just an incredible run of acquisitions and mergers over the years.
So maybe we get into some of these numbers. For the last couple of years, I have watched you. Wendell he goes into the earnings reports and he writes it on his notepad, and you actually crunch the numbers. Nobody's doing that.
I don't think anybody does that. Nobody. It's time consuming, and I do. You're right.
But you love to do it.
I do it. I use a legal pad. I do then create a spreadsheet because it's easier to work with at that point.
I think we should take viewers through the comparisons between 2008, let's say, notably before the Affordable Care Act's passage, to now.
Yeah, we can do that. In 2008, Cigna Cigna's total revenues were $19 billion. That was big. Back when I was there, it was a big company. It had 30,000 employees when I was there, but it has grown leaps and bounds through acquisitions. And last year it was $275 billion in revenue. Centene, which is a company that very few people have ever heard of, is a company that is primarily in the public program space, like Medicare and Medicaid in particular, and largely just in the taxpayer-supported health insurance space. But Centene in 2008 reported about $3.5 billion in revenue. It's $195 billion last year. CVS bought Aetna in 2018. In 2008, Aetna had about $32 billion in revenues. Last year, over $400 billion. Elevance, it is a parent company of about 14 Blue Cross Blue Shield plans around the country.
Wow.
Previously it was called Anthem. Before that, WellPoint. All the Blue Cross plans were nonprofit. That changed in the mid-90s. So Elevance is now the big blues company, or took in $61 billion in 2008, almost $200 billion in 2025. Then Humana, where I used to work also, they took in $29 billion in 2008 and grown to $130 billion in 2025. Almost all of that growth has come from the public programs. It is one of the biggest companies in the Medicare Advantage space. Then you've got Molina, started out as nothing more than just a Medicaid company. It took in $3 billion in 2008, took in $45 billion last year. And then to the big guy, UnitedHealth, which took in $81 billion in 2008, $448 billion last year. That's enormous. And it's not because the company is insuring all that many more people. It's because it's gotten into other lines of business, gotten more and more into the pharmacy supply chain in particular. And all these companies have done that, or gotten into the public programs more aggressively, Medicare and Medicaid, or buying up physician practices and clinics. So the industry has changed incredibly. That's why the revenues are growing as big as they are, is because for the first several years, while I was in the industry, and a few years after that, the growth was what was referred to as horizontal consolidation. The big companies buying smaller companies, and then they bought up all they could or wanted to, and then they started getting into the healthcare delivery space. And that's where most of their acquisitions have been in the last few years. And they're doing this because they are able now to capture not only our premiums and our taxes, but also how much we spend out of pocket on healthcare. So they've got quite a machine going that captures almost every cent we spend on healthcare these days.
Over just a few years, these companies have climbed the Fortune 500 rankings at a pace that's not seen among other corporations on that list. They're just growing at such a rapid rate. UnitedHealth Group, percentage-wise, is growing at a faster rate than Walmart and Exxon. Brands and companies that so many people are familiar with and deal with every day. Cigna's revenue growth has outpaced Disney and Nike and Starbucks. Like, Disney owns theme parks on multiple continents, movie studios, they put out Star Wars now. Like, Disney is huge. The Nike checkmark swoosh logo is one of the most recognizable symbols on the planet. Starbucks has 38,000 stores all across the globe. But even these like global companies don't match the surge that Cigna has had over the years. And Cigna's surge has been largely driven by acquisitions it's made, especially the pharmacy giant Express Scripts. And then there's Humana, which grew at a faster rate than a ton of companies with comparable revenues, Target, PepsiCo. Think about like how much stuff folks buy from Target. PepsiCo isn't just soda, it's Doritos, it's Quaker Oats, and Gatorade. Unlike companies like Uber, PepsiCo, and Target, Humana has grown largely because it's getting a slice of our tax dollars through government programs like Medicare Advantage and Medicaid. Those other companies are at least growing because people are making conscious decisions in the free market to buy their products. Humana has just figured out a way to hook itself up to state and federal piggy banks. Insurers broadly are not playing in the economy like other companies, and they're ascending and growing so rapidly, but they don't, as you said earlier, they don't actually make anything. These companies need to be thought of more as government contractors like Lockheed Martin
Well, they
or
are.
Boeing.
They are.
They're making most of their money from these public programs.
They really are. United, for example, last year, 77% of UnitedHealthcare's revenues came from taxpayers, from public supported plans. A lot of people don't know that whether or not you're enrolled in one of these companies, your tax dollars are going into their revenues. And as you said earlier, these companies have grown. The revenues are far, far bigger than they were before. But between 2024 and 2025, they lost or ran off 10 million enrollees.
I think that's important. How did that happen? How are they able to make this money but less enrollees?
Part of it is the Trump administration played some role because it made changes to the Medicaid program, which made it more difficult for people to stay covered in Medicaid. So some of these companies that have Medicaid business, they lost a little bit of enrollment. But for the most part, these companies have purged their enrollees. Think of it this way: when you overeat, you sometimes feel like you need to vomit, to be kind of gross, and that's why this term purging is used in the industry. It's a term that describes how these companies get rid of enrollees that they wish they hadn't bought in the first place, or they hadn't signed up for their coverage because they've turned out to be more expensive than they anticipated. And as a result of that, they're not able to meet Wall Street's profit expectations. And we're seeing it in the ACA or Obamacare marketplace as well. You're going to see a lot of people disenrolling or dropping their coverage because they can't afford the premiums now that a lot of the subsidies have gone away, but also because these companies are going to drive them away. They decide that they want to leave a particular state or a particular market because they're not making as much money as they want to. So this is called churn, and it's been going on for many, many years, but it's really accelerated in the past few years as Wall Street in particular says, you guys are paying too much for healthcare, so you need to look to see where you can change that, and in many cases is running people off, to purge them, in other words, to get them off the rolls. When I was in the industry, all the companies were using the term medical loss ratio, MLR, and that is a ratio. It tells investors and anyone else who pays attention to these reports what percentage of revenues from the health insurance plans that they sell, what percentage they actually pay out paying claims. And it has Wall Street's objective is to get these companies to pay less and less every single year. And the term medical loss ratio is called that because they consider it a loss every time they pay a claim. Since I've started talking and writing about this, a lot of the companies have actually changed what they call this. They're calling it the medical care ratio or something like that, rather than
Euphemistic BS.
Right. In fact, I think you know this, but the first time I testified before Congress, I talked about the medical loss ratio. I told them about what that Wall Street pressure is like on these companies, and I said it in my testimony that in many cases, insurance companies were not paying out more than 50% of our premium dollars on health care. So Congress passed a law or a provision of the Affordable Care Act that set a minimum of how much these companies have to pay out in
80 to 85%.
85%.
And the rest of the money they can use towards advertising and executive pay.
Yeah, the rest of the money goes, a lot of it goes into the pockets of top executives and shareholders. It also encompasses advertising. They advertise, as you know, a lot, but also administrative cost. And health insurance, as we know it in this country, in the private market, the administrative costs are very, very high. So it's covered there as well, too. As an example of how different it is in the traditional Medicare program, the medical loss ratio is very, very high because the administrative costs are very, very low. It's not that way in the private sector at all, though. But in the traditional Medicare program, almost all of the money that the government takes in, they pay out paying for somebody's care. Not so with private insurance companies.
What are the MLR numbers in the earnings reports from 2025?
In 2025, you started seeing the medical loss ratio tick up a little bit. And that's because a lot of people were somehow figuring out how to get more care. And these companies were paying more claims than investors had expected and somewhat more than in 2024, except Aetna, which was able to please Wall Street by having an MLR that actually ticked down a little bit. And that is because Aetna ran off hundreds of thousands of its enrollees, about 800,000 out of its Medicare Advantage business. When we talk about the medical loss ratio, there's another number that investors look at very closely. It's called earnings per share. And they want to see that go up every year because as that goes up, that means that their net worth is going to be, their holdings are going to be more valuable. To influence that, these companies often will buy back big chunks of their own stock, their own common stock. When they do that, that reduces the number of shares outstanding, and that artificially inflates the earnings per share. So they've been doing this a lot in recent years. To the point that I think between 2014 and 2024, these 7 companies bought back about $140 billion worth of their own stock. They didn't use that to reduce premiums or to reduce out-of-pocket costs, but to change the calculation of their earnings per share so that it would be higher. It would boost that. And the executives of those companies that are paid mostly in stock saw their net worth increase when they do that.
All right, Wen, so I want to take everybody through these earning documents.
You want to start with United?
We're always mean to United. Start with Cigna.
Cigna? All right, this is their year-end 2025. Here's what is now their biggest division. It's called Evernorth, and that's where their PBM business is located. Last year, they took in $132 billion from their PBM. Altogether, Evernorth brought in $235 billion. It shows you how that this company is now a PBM that also operates a health insurance company.
All right, so pull up the Aetna.
So this is CVS. This is the Aetna section, which is healthcare benefits. In 2025, they call it medical benefit ratio. It was 91.2%. That was great news for Wall Street, not so great news for people enrolled in Aetna plans.
What about UnitedHealth?
It gets way more money from the federal government, $266 billion, when you add these two up here. So that's 77% of their health plan revenues come from taxpayers. Be America's most trusted healthcare company.
Yeah, right.
Yeah, right. But it's hard. You had to go through countless pages, and they throw so much information at you. You have to go through all this, and you have to do math they don't do to figure out what you really need to find out. They make it very, very complicated. There's the impression that they're being forthcoming with a lot of information, but they hide and obscure a ton of information.
I think we've reached the end of this episode, and I know it was a lot of numbers and a lot of charts, but these earnings reports are the proof of what these guys are doing and who these companies are.
Mm-hmm.
Wendell, why is it important that folks see what's inside these documents?
Well, these documents are the evidence of what we've been talking about, how people are getting screwed by these big companies, how they're making us pay more and more for our health insurance every year, how they're grabbing more money from us as taxpayers, from the pharmacy supply chain, and making us pay more for coverage than ever before. Every single year, our coverage goes up. These numbers are in here. You have to read these reports to see how they're doing. And what I do, as you know, is compare not only to the year prior, but to look at what's happening over a span of 10 or more years. And that it's really important for people, journalists in particular, to do this. And not many reporters take the time to do this either. But you can see this is how we know how they took in $1.7 trillion in revenue last year, and that they made $54 billion in profits, and that they insured 10 million fewer people. The numbers are here. You have to look for it, but it's really important for Americans to understand this is how these companies are making so much money to please Wall Street, while the rest of us are paying a very steep price for that.
Thank you, everyone, for tuning in today. Healthcare Uncovered is a reader-supported publication. Like, share, and subscribe at our Substack. Thank you for tuning in.